Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. Today we're reporting one new case of COVID-19. The case is in the Central Zone and related to a previously reported case. Since our last briefing, there have been 15 new cases confirmed. We currently have 16 active cases. We are very concerned how quickly these cases are creeping up and the potential exposure that might exist. Dr. Strang will go into more detail, but I want to talk to you about a couple of situations we are looking at. We do know one is connected to travel outside of the Atlantic bubble. People came here and did not isolate alone. They quarantined at a residence, perhaps with best intentions, but exposed others in the household. That stops today. Effective immediately, if you are coming into our province from outside of the Atlantic bubble, you must quarantine for 14 days alone, away from people who are not quarantining. If you are not able to isolate alone, then everyone in that household isolates together for 14 days. What that means is what it says. You don't go to work, you don't go to school, and you don't go to the grocery store or a restaurant. By accepting people into your home from outside of the Atlantic bubble without a 14-day isolation plan for them, you are subject to that quarantine. We're also looking at a cluster in Clayton Park. I'm worried about the level of potential exposure in this area. This is why we are deploying our mobile testing unit to ensure people get tested faster. We are not targeting the community or any individual. We are trying to wrap our arms around the geographical area in Central Zone to protect people, to support people, and to make sure we contain the virus to prevent further spread. Rotational workers are in and out of our province, and I am worried about their movement as well. Many of them are outside of the bubble for 14 days and then home for 14 days. We've allowed them to isolate with their own families before heading back to work. But now with the second wave underway, and so many cases climbing across the country, I've asked Dr. Strang and his team to come up with a new strategy that will require a level of isolation and testing during their time at home. We are looking at an isolation period similar to that of Newfoundland. The worker arrives home, isolates with restrictions, and on day 5 gets tested. I understand this is hard, and compared with the rest of the country, we look pretty good. But a number of my colleagues across the country would say that they were doing well too. When out of nowhere, they went from a dozen cases to hundreds of cases in no time at all. And now there are provinces dealing with COVID in some long-term care facilities. We have been there, and we don't want to go back. So that's why we need to crack down quickly, but carefully. This is very serious. Dr. Strang, over to you.
Thank you, Premier. Good afternoon, everybody. Our last briefing was on Tuesday, November 3rd, and since then we have announced 50 new cases of COVID-19, including a single case that we reported today. So we now have 16 active cases. Our cumulative numbers are 1,129 cases of COVID-19 in total in the province, 117,623 negative test results, and 65 deaths. Yesterday, Nova Scotia Health Authority's lab completed 658 tests. At our last briefing, I talked about 2 active clusters, one in Central Zone and one in Northern. Both were related to travel outside Atlantic Canada. I'm pleased to report that both of these clusters are considered contained at this point. The positive cases have been identified and they are isolating now as required, and the close contacts and secondary contacts have all been tested and are negative. Our latest cases are part of a new cluster of COVID-19 in Central Zone, specifically in the Clayton Park area. This includes the Clayton Park Rockingham area over to Carney Lake Road between the Bedford Basin and Highway 102, Bears Lake, and Lakeside. My public health colleagues have been working all weekend to identify and isolate and test known and possible contacts of these most recent confirmed cases. While all the cases are connected to the Clayton Park cluster, as you've seen from the recent notices from the Nova Scotia Health Authority, there have been potential exposures throughout HRM. Dartmouth, Bedford, Bayers Lake, and downtown Halifax. As we investigate positive cases, we may learn a person spent time in a community setting, such as a restaurant or a store, while they were potentially infectious. If we're unsure that we have found all the contacts through direct reach out, we do send out public exposure notices simply to ensure that everyone who may have been in close contact of a positive case is aware and can take the appropriate actions. However, as I've said previously, we only send out these notices if we need to, but we will always do so if there is uncertainty. So related to this new cluster, there are 3 specific locations where our normal approach is to say you may have been exposed, monitor your symptoms. But at these 3 locations, we have enough information, and we have had a positive case from one of them, that we want anybody who was at these places, and I'll go through the dates and times in a minute, to reach out, to call 811, and to make an arrangement to get tested. So if anybody was at the Bitter End a bar in downtown Halifax on November 2nd, between 9 p.m. and closing, if they were at the Montana's restaurant in Bayers Lake on October 25th from 6 p.m. until closing, and at the St. Andrew's United Church on Coburg Road during an All Nations Full Gospel Church service on October 25th at 6 p.m. So if anybody was at any of those 3 locations during that date and time, that it's critically important that they know that they may have been exposed to COVID-19, and even if they don't think they have come into contact with anyone, even if they aren't experiencing symptoms, we are asking those people to, as I said, call 811. 811 will make the arrangements and get you in appointment for testing. I do know that there was some confusion on the weekend for people seeing these notices, and we're calling 811. We had thought that communication had happened to 811. It wasn't clear. That miscommunication has been resolved. So if people did call over the weekend and were told they didn't need testing, we were asking them, if they have the right exposure, call back 811. You will get make an arrangement to have testing for you now. We are putting plans in place to make testing faster and easier to access for people who are linked to this cluster. So that the Health Authority has dedicated existing resources at the Halifax Infirmary testing site, specifically for people who may have been exposed as the locations that I just talked about. So we want people to get in with possible exposures to get in and tested as quickly as possible. So we're diverting general people phoning in for symptoms. We're diverting them to other testing sites like the WK, like the down in St. Mary's, or the Dartmouth drive-through site, and the Halifax Infirmary site has now dedicated time specifically to get people in that may have had an exposure at one of these locations. We're also working with the Mobile Outreach Street Health van and EHS to set up mobile testing in the Clayton Park area, and the Health Authority is doing the work to assess the locations for a potential temporary primary assessment center, as we did during Wave 1 for other community clusters, if that in fact is necessary. We've also put steps in place today to making sure that people without health insurance can get testing at no cost like anyone else in Nova Scotia. That has been raised as a barrier in certain circumstances. We're making sure that cost is not an issue when people come forward for testing. But we are asking that anyone who gets a call from public health during the contact testing process, that we need them to be open and honest about where they've been, who they've been with, and when. We're having some challenges there, but it's important that people understand that public health is here to help them. That is all. We're not here to judge. We're not here to we're just here to help people. Our only priority is to contain the spread of the virus. And we can only do that if people are honest with us about the details about where they might have been, who they've been in contact with. So we need people to help us out if we're going to get in front of this cluster and stop it in our tracks and minimize the chance for it to spread further. It is a wake-up call for all of us. We have been very lucky in this province in the last several months to have low or no COVID cases. And as a result, we've been able to go about our lives relatively normally. But as the Premier said, as I said last week, when it comes to COVID, things can change very quickly. We are at a tipping point right now here in Nova Scotia. I've had a very anxious weekend. We are at a critical tipping point that we all need to pay attention to. If you didn't pay attention after our briefing last week, you need to sit up and pay attention now. We all need to make changes if we're going to change our trajectory. As the Premier mentioned, we're making changes to the order that means that anyone traveling into Nova Scotia from outside Atlantic Canada must isolate alone for 14 days. And if they're coming into the province for travel, and they don't have that option to isolate alone, and they have to stay in a residence, whether it's an apartment or a house, everybody in that location then needs to start a 14-day isolation period. So it's not just 14 days, if the person who comes in has to isolate for 14 days, but if that person, let's say a person stayed in a hotel for 5 days and then went to start to live with relatives on day 6, and that person then has 8 more days of isolation. Other people he or she is now positively exposed, they don't just have to isolate for the remaining 8 days for the traveler, they actually have to isolate for a full 14 days. So people need to understand, if they are taking people into their home and living with them when the traveler is in a quarantine period, they're imposing a full 14-day isolation period on themselves and the rest of their household members. It means, and that really means that if they choose to do that, it means kids can't go to school, people cannot go to work, you can't go shopping, you can't go to the grocery store. So that sounds harsh, but it's necessary that we actually, with COVID, the second wave of COVID in full force around us in other parts of the country, we need to make sure that we minimize any chance for travelers coming in here, then spreading it to others who then are out in the community. This does not apply to exemptions that are already in place for necessary essential workers, truckers moving over the border, military, police, emergency responders. It does, as the Premier said, it does not apply to rotational workers, but we are looking at a separate specific strategy for rotational workers. We also are looking at how we tighten up around our specialized worker program, as well as our compassionate exemptions. All of the ways that people enter into the province, we're actively, rapidly looking at ways we tighten up on all of those, along with now the requirement of a 14-day household isolation if you're hosting, if you will, a traveler. This is the only change we're making in our public health regulations today. But I'm fully engaged with the public health team who is dealing with this cluster. I have another meeting with them this afternoon, and on the table we are actively discussing where we might need to go next in terms of other places that we start to tighten up restrictions if necessary. But what we all need to do today is to start to be even more cautious. It's the time to be, if there ever was a time that we really need to be vigilant, now is the time to start. So we need for everybody, every Nova Scotian, to step up their personal public health measures. Stay home if you're unwell. One of our cases is related to somebody who was symptomatic but still chose to go out and socialize. If you're not feeling well, stay home. Wash your hands frequently. Practice good cough and sneeze etiquette. Wear a mask, especially it's required unless you have a specific medical reason not to. It's required to wear a mask in all indoor public places, and you need to wear the mask properly. Properly covering your nose and mouth. Wearing a face shield does not replace the need to wear a mask. And stay away 2 meters away from anybody if at all possible, especially people who aren't in your close social circle. A key message is that now is the time for all of us to start to reduce our social activities and to restrict social activities to people that are in our household or close social bubble. And those, again, reminding people those should be no more than 10. And ideally, we would have few, and ideally only one of those close social bubbles, people that we interact with. We need to start ramping down our social activities, being very careful of the number of people that we're interacting with. This applies for all Nova Scotians, but is particularly important right here today in Metro Halifax. I am hearing concerning stories about not only about people traveling in and out outside of Canada, Atlantic Canada, but many stories around really non-essential travel. People just thinking it's okay to just to go visit somebody in Toronto and come back, or I get the need for that, but we are in the middle of a pandemic. Non-essential travel in and out of Atlantic Canada needs to stop. Now is not the time just for casual visiting, as important as that may be in terms of maintaining relationships, but we need to visit virtually. We need to be very cautious about only having necessary travel across in and out of Nova Scotia. That leads me to say that it's the time for us to start thinking and planning for the holiday season in mind, that we need to be cognizant that this holiday season is going to have to look differently, that non-essential travel out in and out of the Atlantic bubble should not be taking place. You should not be planning to be doing that in the holiday season. And if you and you also have to be cognizant as you're starting to think about your holiday plans, the requirement now that if you do bring people into your house who are from outside of the Atlantic bubble, your whole household now is on a 14-day isolation period over the holidays. People need to start. It's important that I make people aware of that now as they start to think about what their holiday plans might be. This holiday season needs to be thought about very differently than a normal holiday season because we are in a pandemic. I mentioned last week that my team, we've been working on a plan of how we would start to reimpose various restrictions as they need to come into place. I know people are looking for a very predictable plan about what's going to happen when, and we are working on a framework for that, but that there is always going to have to be some flexibility and an ability to adapt to evolving circumstances that we do that. So we're in the process of starting to move that forward, and then this week within government and starting to engage different sectors to get their input on that. We certainly don't plan to lock the province down again unless that's absolutely necessary. There's no question that was the right approach in Wave 1, but this time around, as you've heard me say, our plan is to, if at all possible, take a much more targeted approach based on geography, various sectors, and high-risk populations. Our goal is to contain COVID, not to have zero cases, but to contain it and not have wide community spread. And we need to be especially cognizant of high-risk areas that, like long-term care facilities, where outbreaks would have a substantive impact. But right now, we're at a place, as I said, we're still we have been in a very good place, but our fate is in our collective hands, if you will. If you just look around the rest of the country, that I just saw last night, BC, Alberta, Saskatchewan, Manitoba, Ontario, Quebec, all reporting record numbers of cases. We have to do everything we can do to stop ourselves getting into that similar situations, because we will get overwhelmed and our healthcare system will get overwhelmed. We will put all of us at substantive risk. I had reports this morning talking to my team that there were, as they're out and about or talking to family and friends on the weekend, stories about entire families with kids and grandparents all going shopping together, people not worrying about social distancing, people not wearing masks or not wearing them properly. We need to put an end to that. We need to start thinking about what did we do in Wave 1 that stopped the wave and kept us safe, and how do we reapply that in all the things we do and think about in our daily lives. By doing that, we will keep ourselves COVID safe. And it's all about, not just about ourselves, it's about our loved ones, our neighbors, our healthcare workers who go to work every day prepared to put themselves at risk in case they need to look after us if one of us have COVID or some other health event. And it's about our communities in general, that we all need to do what's necessary to keep each other safe. Premier.
Thank you, Dr. Strang. Tina, over to you.
We'll start with Mike Gorman. Again, just a reminder, we'll take one question and one follow-up from reporters in the room, and then we'll go to the phone lines. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Dr. Strang, given this concerning cluster that's in Clayton Park and previous comments from you about the ability to target restrictions regionally and locally compared to the first wave, is there any consideration to changing what's going on in the schools in Clayton Park right now, given that those are some of the largest and busiest schools in the whole province?
Yeah, we're very well aware of the potential risk for schools. My team was communicating with education today, and what we've said, none of our cases are school-aged. But what we've said is we're closely watching this. There are potential implications for schools, and what we've said is that you need to be prepared that in some time in the coming days or weeks or week or so, that there may be a new need, and I qualify this, there may be a need to enhance restrictions or even go to a blended model. So we're just putting them on the alert. We're not there yet, it's not necessary, but we're putting them on the alert that we may need to be going in that direction. A lot depends what the next several days happen as the team digs in more and finds out more about this cluster, and both in terms of as we're testing people within the cluster itself, as well as the results we get back from all the people that were in these potential community exposure sites. The next few days as we get results from those places and how many new cases we start seeing and what are the circumstances around those cases will tell us. We're at a point where we can't say that there is broad community spread, but we can say there's not either. So we need to let the public health do its work. So you're absolutely right. To identify schools as potentially a point of concern. As I said, we have put the education and the schools in that area on notice, if you will.
I have so many questions, but you've just blown that up for me, so I'll ask you this. If schools are on notice and the education department is on notice, and Premier, maybe you have insight into this as well, what is the communication protocol for parents? What are education officials being told in terms of, one, letting parents know, and two, what kind of lead time parents perhaps should expect should it get to the point where you have to go to a blended model or perhaps outright shut down a school?
So we have an established communication protocol that's been agreed to by both education and public health, that if there are cases of whether it's staff, students, or teachers in a school, that there has been exposure in the school, we have very rapid and timely communication out to that school community. That's all in place, ready to go. We have not, it's important to emphasize, we have not had any exposures in the school at this point, but we've got well-established protocols ready to go to make sure that parents are well aware, and that's in reaction to possible cases. If we're getting to the point where we may need to go to a blended model, we're not going to spring that on people in surprise. We may have to do it fairly quickly, but we'll be working with education on the communication parts of that as well.
And just to follow what Dr. Strang said, we'll move to a blended model, something that the Minister of Education announced in the spring. Those protocols were being in place at the school communities across the province. Obviously, we'll isolate a family of schools if required. In this particular case, we're talking about a community, but it may be in community I live in or some other. We would isolate those schools and send that. As it was in the spring, we know this will create challenges for individual families. Each one of us do home care and child care differently. So there's not 100%. There's not a plan that you can do that 100% will meet every situation that we're faced with, but I feel very confident that we're in a much better position than we were in the spring to be able to respond to the unique needs of individual school communities by working and collaborating together.
Next, we'll go to Alicia Drost from Global. Go ahead, Alicia.
So 3 of the possible exposure locations, you guys have said that you've asked anyone who was there during those timeframes to call 811 regardless of symptoms, which is different from the other locations. So I'm just wondering why specifically that's happening. And I also know that the NSHA has asked any employees who were there to not come to work, and I'm wondering why they're doing that, and you're not telling the broad public to maybe stay home if they were at those locations.
So to your second question, that's an occupational health decision that made by the health authority. They're going a step further in terms of protecting their healthcare environment and protecting patients. That's their decision to do that. We're not at a point yet where it's necessary to put those type of restrictions in other workplaces from a public health perspective. The reason we have had it gone to a higher level of asking people in the 3 locations to go straight to testing, because as I said, in one of those cases, we have an individual who their only risk of having COVID was being in at one of the locations and at the appropriate time and place, and she's now a positive case. So, and there's some other circumstances with the other ones where there's the potential for, there's a higher likelihood that people may have been exposed in these three sites than the other community locations, which has led us to strengthen our approach and saying, don't just monitor your health and wait for symptoms. We need everybody, whether they're symptomatic or not, is to go in and be tested, because one of the things is around asymptomatic spread, but some of the unique circumstances in these three locations as well makes it a higher likelihood that people might have been exposed.
Go ahead with your follow-up, Alicia.
I know in the past that we've talked about enforcement, and the message has kind of been, we're just kind of hoping that everybody follows the rules, and we don't want to, I guess, rule with an iron fist, so to speak. But I'm just wondering now, you mentioned that one individual had symptoms and they went out into the community, and that's why we're having some of this possible exposures. So should we have stricter enforcement and fining these people who are breaking the rules?
So we're actively, one of the things we're working on now, it was before this weekend even, is looking at the team that is doing, people who come into the province have to do a self-check-in, and there's been work going on started prior to this weekend about how we might strengthen our enforcement approach around that whole piece.
And I think it's fair to say, and let's be frank, the vast majority of Nova Scotians know the rules are clear, they're following them, and they're working with their families to follow those rules. But to suggest that there's been no enforcement over the last period of time is not accurate. There's been people we've gotten calls from communities who've said a cottage has been rented to people from outside of our province. Police have gone to investigate whether or not that is actually factual, and if it is, are they quarantined for those 14 days? So we'll continue to monitor that, and as Dr. Strang said, if we need to go further, we'll do that.
It's important for people to understand that, to the Premier's point, that we do have people that are required. They come in, the self-check-in form. They need to be doing a daily. We have a digital daily check-in that they have to do, and if people are not following through in that digital check-in, that is then handed over to a potential enforcement. So there are measures in place. We're looking at how we might enhance that and make that even stronger.
Next, we'll go to Sarah Plowland from CTV. Go ahead, Sarah.
Regarding the Clayton Park cluster, can you give us an idea of the scope of this? How many people are possibly at this moment self-isolating, getting tested because of this cluster? And perhaps how many of the 16 active cases stem from this cluster?
We have, I believe there's 9 of our cases are related in this cluster. I don't have a number in terms of how many contacts, et cetera. That has changed throughout even today as we're investigating cases even more. But we have those 9 cases. There's a complex interaction between the different cases that we're still trying to tease out. That what were their exact interactions, and how do we trace one person's case being linked to another person's case? What was the ultimate source of? Can we wrap them all together and say this is where the cluster started and how it might have spread? So looking backwards, but at the same time we're looking forward and saying all our cases, where were they and who might they have exposed? So that is the work that public health is engaged in right now.
Go ahead, Sarah, with your follow-up.
And can you tell us approximately how many cases are under investigation? How many people are being contacted through the process that you just mentioned?
So, as I said, we've got 16 active cases. A lot of those are pretty well wrapped up, but we have the 9 active cases that are part of this cluster, that there's a lot of attention being applied to them. I would say they're all under active investigation at this point. There's none of them that we say that we've finished our investigation in terms of where they might have been exposed and where they got infected, and then also a number of them are, all the cases are, as soon as they come to our attention, they're under isolation, and we're much more comfortable about where they may have been in the time period when they became infectious, and that's why we're doing all the public notices. What we need to do more work on is where they may have been exposed to, and what is the interaction between the different cases within the community that could explain how person A might have got it from person B, et cetera.
I also think the question you're asking is a valid one, but sometimes it's hard to answer that. And I want to thank, first of all, many of the private businesses out there who have actually been taking names of people when they've been coming in and taking proactive steps. Like the bar here, I think it's called the Bitter End, took a proactive approach that not necessarily everybody who would have been exposed that day, but everyone who works for them is being tested. So that would broaden that number a bit more. Hard to grab a handle on that. The worship event that took place that was interdenominational, the number of people there would vary. So it's hard to give you an exact number, but it's fair to say that every time somebody is added to the list, the number of tests grows exponentially, and that's why we're concerned about. And if you're been at a particular an event, so if you've been at a grocery store picking up, the risk is still there. Probably not as high as it is if you've been in a gospel place singing or worshiping in a closer contact. So I think to rest assured that as soon as we get information on numbers and the number of tests we do, we'll communicate it to Nova Scotians. But I think from the very beginning of the beginning of this exposure has been the complexity of it. And every time a new case comes up, you find a different path where people may have been connected, and that's what we're continuing to work on, and public health is working on. And this will take a community effort. So those businesses continue to record who comes in and when they're there. That's helpful. Very quickly to be able to communicate out. That's not left to chance that someone may not hear the news. We know who's been there. When stores have had an exposure, we list them. We require the help of those stores to be able to communicate that loudly within their stores on an ongoing basis and regularly. That if some of you are in this store in such and such a time, please call public health.
Next, we'll go to Brian Flynn from All Nova Scotia. Go ahead, Brian.
I was wondering if one of you or perhaps both of you could talk a bit about how it was possible before today for somebody to be in quarantine and the people they were in quarantine with were permitted to come and go. I think a lot of Nova Scotians will be surprised to hear that that was actually permissible until today.
So if you remember, in wave one, it wasn't permissible because of the risk. As we got into our reopening through the summer, and everything's about a balance. So knowing that when you require people to be isolated and not go to school work, there are impacts from that. Our judgment was that the risk of somebody coming in from outside of the Atlantic provinces, while that person needed to have this to be isolated, the risk of them actually having COVID was low enough that there was minimal risk by allowing their household members to continue on their daily activities. Now that we've gotten into the second wave in other parts of the province, that risk equation changes again. So now there's enough increased risk that it's reasonable to apply the quarantine for the rest of the people in the household, even knowing that quarantine puts significant restrictions on their lives. So everything is about balancing COVID versus trying to keep things open as much as possible. And that risk balance changes as the COVID activity changes, whether it's here in Nova Scotia, whether it's in other parts of the country, or even internationally.
Go ahead, Brian.
Sure. I was wondering also if, Dr. Strang, it sounds like you're describing a case of community spread here. I'm just wondering, you didn't use those words, and I'm just wondering if it's fair for us to characterize it that way. Is that what's indeed happened here?
So we've had community exposures, but everything we're seeing in what we're seeing in the Clayton Park area, there's groups who are socially connected that we're trying to tease apart. Every time we have a new case, we're finding, and there was another social occasion within this, these groups of people that explains things, not just being out in the. To me, general community spread is I'm just out and about and I happen to be at a restaurant or something and I'm exposed. We have a few places where that are very concerning. So that's why I said earlier, I'm not at a point where I'm going to conclude that we have general community spread, but I'm also not at a point where I can rule that out either. This is, I say, you've asked me before and other things about, this is like detective work. We're in the middle of a complex investigation. We're always going to err on the side of the caution, but we still have some work to do before we can make some firmer conclusions. And that's why we may, as this progresses and we get more test results back on people, we get a sense of how the virus might be spreading, we may have to impose further restrictions, including about schools, but we're not there yet, and I don't believe there's enough of a risk that we have to let the work proceed before we unnecessarily impose restrictions. And quite frankly, the risk calculation in my head and the advice I give is probably going to change several times over the next 48 hours as we get more information. It's a very fluid situation.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead.
Dr. Strang, some provinces have suspended contact tracing due to a low capacity. So I was wondering if you could speak to how prepared we are for high caseloads and what's the capacity here for contact tracing?
So we've got a number of things in place. Our objective is to maintain contact tracing as much as possible. So through the federal restart funding, the Nova Scotia Health Authority Public Health is in the process of, we've got funding to fill up to 100 additional positions for public health in the short term to either do contact tracing or to allow others who are already in public health to do contact tracing. We're also in discussions with the federal government. They have a surge capacity program that provinces and territories can look to. So we're in the middle of conversations about how that federal program could further supplement our contact tracing capacity here in Nova Scotia. So I guess the short answer is we're actively building capacity, knowing that the ability to maintain contact tracing is fundamentally important for us to be able to keep a handle of where we're at with COVID.
Go ahead with your follow-up.
I'm wondering, with the uptick of cases now, do we still plan on taking on testing for Ontario, and how's that going in general?
So I heard last week that they finally reached an agreement between the health authority and the Ontario government. I think the Ontario government had a very long process to get to the point of having an agreement. We've been prepared to do this. We will always our commitment to Ontario has always been that as long as we have capacity, we're prepared to support you in doing testing. But as soon as the needs to test Nova Scotians will always be a priority. So I guess the answer is we will continue to we'll do that testing for Ontario as long as we have the capacity. And they're well aware of that. But it's up to 1,000 tests a day, but even if we can only do 500, we'll do the 500. But it's all contingent. We will never put testing for Ontario ahead of the needs to make sure that we're testing Nova Scotians appropriately.
Next, we'll go to Tim Bousquet from the Halifax Examiner.
Excuse me, Dr. Strang, you said in answer to another question, well, it's not community spread because people aren't going out in the community and getting it. But doesn't that contradict that somebody, I think at the bitter end, you said a woman, she got it and you couldn't trace it to anywhere else. So can you, I think what the public wants to know, this person got it at some place. Was it incidental contact? Was it a server? Was it someone they were sitting with? Was it the next table over? They want those kind of details. They don't need to know any names, but they want to know how this one person got it, so that they can assess their own risk when they go out.
What I know, when we know there were two people from two different parties were at the same bar at the same place. I don't think we know how much interaction those people had, but they were in the bar at the same place. So we have a single case of somebody, their only risk for having it is that they're them being in the same location as somebody from a known cluster. Is that enough to say community spread? It's a single case. What it does is highlight that we all need to be on the alert. I don't know if that person was wearing a mask. Were the other people wearing a mask? Although, a range of questions. But it's a reminder for us for all of us to be what I call step up our game in terms of COVID safety. And as we follow this investigation, I may well come to a conclusion that we have broader community spread and that we need to impose further restrictions. Or we may actually in the next couple of days be able to say, with a few cases aside, we can explain within a tight circle how this virus was circulating around. We're right in the middle of that investigation.
We all make mistakes. Over the weekend, there were a handful of updates from public health, wrong seat numbers on a plane, wrong BMO center. improper messaging apparently for people calling. You know, most mistakes aren't matters of life and death. Does this concern you at all?
I think NSHA, anytime we make, there's inaccuracies in what we're communicating to the public, we need to pay attention to and learn from it. I'm very confident NSHA is well aware of the errors they've made and are correcting that.
Next, we'll go to the phone lines. Again, a reminder, we'll take one question and one follow-up in the amount of time that we'll have. We'll start with Katie Hartite from News 95.7. Go ahead, Katie.
Thank you. The digital daily check-in for people who are isolating is a 5-part questionnaire that's entirely based on honesty. Now, you told Alicia a few minutes ago that the province is considering additional enforcement. Can you tell us a little bit more about what that might look like?
So there's a team looking at what the additional enforcement might look like. They're going to come back in a timely manner to say what are the options around that. I'm not involved in the details of what that may be at this point.
Go ahead, Katie, with your follow-up.
Okay, and do we know how many people have downloaded the COVID Alert app in Nova Scotia and how successful, I guess, it is here?
I don't get an update on that. I haven't heard from the federal government about recently about how many downloads there may have been.
I don't believe the federal government is actually releasing the numbers of people who've done. I downloaded it, but I don't know if they're, for whatever reason, I don't know if they're putting out the number of people who've downloaded that app from a particular province or region.
Next, we'll go to Olivier Lefebvre, Radio-Canada. Go ahead, Olivier.
Thank you. I would start by asking Dr. Strang, what does the announcement today by Pfizer on its vaccine candidate mean for Nova Scotians?
So I have not seen what the announcement from Pfizer says, so it's really hard for me to comment.
Go ahead with your follow-up, Olivier.
Okay, Dr. Strang, you insisted that people have to be honest with public health if they receive a phone call. Does this mean it's a big problem at the moment?
So we have just some challenges, and some people don't truly understand, what is the purpose of public health. There are certain parts of our population who may not be that comfortable when they get a call from what they consider a government agency, and especially when we're asking questions about where you were in the last, 48 hours, or who you were with, what you were doing. But I think we're just trying to reassure people that this is all built on trying to keep them and their community, their families safe, that we need this information to inform the work that we do in terms of who else we need to test, what decisions we need to make in public health. So I just put that out there as a reminder, certainly public health on the front lines as they work with individuals and families, deliver the same message, and they spend a lot of time or have to spend a lot of time with certain families or certain individuals to build trust and confidence to get the level of detailed information that we need to get.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thanks, Tina. Dr. Strang, would you say the second wave has now arrived in Nova Scotia? And if not, how will we know when it has?
So I don't believe where the second wave is. We're certainly seeing the impact of the second wave elsewhere by having more people traveling into Nova Scotia with COVID. I would say that for me, the second wave would be here if we actually get established community transmission and have that confirmed. We're working really hard to try to avoid that possibility. And even if it gets here, we're working really hard, and we'll continue to work really hard to avoid the large surges that are happening in other parts of the country. So this is all about prevention. It's about being proactive, about being realistic about what we're going to see happening, but also having things in place to minimize the chance for large spread.
Go ahead, Kyle, with your follow-up.
Okay. Well, in terms, you also talked earlier about containing the virus rather than eliminating it. So what sort of numbers are you thinking are safe in terms of daily new cases or people in the hospital or whatever? And what is our current capacity in terms of hospital beds and ICU beds?
So I don't have an established number like X number of cases a day is okay, because it all depends around the context of the cases. One case may have 3 contacts. Another case may have 50 contacts, and those contacts may be in in higher risk situations. So it's not really just about numbers. It's about really the contacts and what is the risk of it spreading further, especially into higher risk environments. I don't have the numbers in front of me about our current ICU capacity or our bed capacity in the health authority.
Next, we'll go to Jean Laroche, CBC. Go ahead, Jean.
Good afternoon, gentlemen. I just wondered, Dr. Strang, you talked about this is as far as you're willing to go today, but you are looking at next steps. Could you talk to us about what those next steps look like?
So if you think about what we had to do and then what we slowly lifted during wave one. So we've now opened up. We allow, even within groups of 10, we have full capacity in restaurants. Within maintaining the physical distance between groups. We've allowed larger groups for sports, for theater, for arts, up to 50 without physical distancing. I just use those as two examples, things that we've opened up in the recent over the last few months. That to me is a logical place where we'd start to roll back. To me, where we need to focus on and how we know this virus is being transmitted and what is really driving transmission in other jurisdictions, it's all around social activities, larger numbers of people getting together, especially in close contact, especially without masking. So as we look to tighten down, we'll be specifically focusing in that social area. And that's why we're starting today with reminding Nova Scotians to themselves start to make choices that limit their social activities. You should not be going out to a restaurant today, another restaurant tomorrow, to the bar on Thursday, having a party with friends Friday, unless you're doing that with all consistently the same group of people. So we need to be cognizant about what are the risk environments and limiting our exposure into those risk environments. And a key piece is that staying within small numbers, 10, no more than 10, having that group of people of up to 10 consistent, making sure that you're keeping distance even within that group of 10 if you can, wearing masks when you're going in public places. Those are all the rules that we currently have right now. But we need to make sure we're following the rules before and then if we need to tighten up rules that will further restrict social activities, that's where we'll start to, that's where our thinking is already, Jean, where we might need to go.
Go ahead, John, with your follow-up.
Dr. Strang, as you know, a lot of university kids like to go home for the holidays, and the universities individually have been making plans to bring those kids back to self-isolate and the rest of it. In light of what's happening, should everyone simply stay put, and do you have any power to do that?
So I don't think we can stop kids from going home if they want to go home with their families. But what we do have the ability to do, if they do that and leave the bubble, coming back in, they will have to undergo a tight 14-day quarantine period, and the schools are already looking at that. But what we're saying is really limit non-essential travel. I've got university age, or one of my kids is in university. She's here locally, but I can get it if a family, their university age child going home. To me, you could almost put that in a bucket of essential. But now's not the time to be thinking, I'm going to get my family, we're all going to go visit our cousins or aunt and uncle in Toronto for Christmas. Stay put. Celebrate with your family and friends that are already here in the bubble, and then maybe you'll wait till COVID is gone before you think about those non-essential travel with friends and relatives in other parts of the country or in other parts of the globe.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tim. We talked a lot today about COVID creep. It's a real concern, and we don't want to see our numbers go up. We can contain this if we take it seriously. But I am worried people are becoming complacent. It's not only about the 14 days of isolation. It's not only about people coming from outside of the Atlantic bubble. It's also about how we behave inside of the bubble. Today, we've been asked a couple of times about community spread. We have no evidence of that as Dr. Strang continues to do his work. But all of us, as we're out and about, should have that in the back of our mind that that's a possibility and should be taking the precautions as we should. We should ask ourselves, did I go out on the weekend? Did I wear a mask? Did I keep my distance? Ask yourself, do I consider protecting people? Do I consider protecting people around me? Do I care as much as I did when COVID first started? Do I even think about COVID when I am out and about? I hope these questions make you think a bit. We are still in the middle of a pandemic. We've had great success, but we need to continue to ask ourselves these questions and continue to follow the public health protocol. If you feel like you are letting your guard down, then it's time to smarten up, follow the protocols, and start caring about what really matters, each other.